With cases of hospitalization on the rise in the country throughout the many Covid-19 waves the country has battled so far, the issue of easing the pressure on the health sector has been at the forefront of the efforts. With that, health authorities commenced a pilot project recently in the Western Province, where asymptomatic patients were to be treated in their homes through a systematic process of close monitoring. With the project still underway, Deputy Director of Education and Research at the Ministry of Health, Dr. Hemantha Herath, commented on its current status.
This system is kept alive throughout the past, even though there is a decline of patients, because we should not disband this system, because if the need arises, again establishing it is a little difficult process. So therefore, even at this moment, this pilot project is going on, and there are patients kept at home and looked after through this system. So therefore, I would like to inform the public that don't get unnecessarily worried about keeping these patients. There is a system through which their general condition is monitored, and if somebody gets any complications or illness becomes worse, they will be immediately transferred to nearest hospital and then required care will be given.
Further, Dr. Herath also responded to media reports which he says had erroneously quoted him with regards to a lack of sufficient oxygen supplies to treat Covid-19 patients.
I would inform that I have not made such a statement, and also I would like to state that the Health Ministry is capable of catering the demand of oxygen, not only the current demand existing at this moment, but any excessive demand, unexpected, and the Ministry of Health has made all plans to make sure that buffer capacity is available to treat or provide oxygen to needy patients.
Meanwhile, yesterday 1,711 Covid-19 infections were reported in the island. The Colombo district confirmed the highest infections with 481, while Gampa reported the second highest of 310. In addition, 228 infections were reported from Kalutara and 109 from Batikalo. The remaining 560 infections came from 21 other districts. Further, 23 foreign arrivals too tested positive for Covid-19 during yesterday. Meanwhile, in more good news for the country's vaccination drive, the Sri Lankan embassy in China announced that a further 4 million doses of Sinopharm vaccines will arrive in Sri Lanka between the 4th and 8th of August. So far, Sri Lanka has obtained 10.8 million doses from China. In more news, Minister of Health Pavitra Vanyarachi confirmed that 728,460 doses of AstraZeneca vaccines will land in Sri Lanka next Saturday. According to the minister, priority is to be given to 490,000 people who obtain their first doses of the AstraZeneca vaccine. In the meantime, 380,463 people were inoculated yesterday. According to the epidemiology unit, 338,914 people were administered the first dose of the Sinopharm vaccine, while 28,054 received the second dose. In addition, 30 people were inoculated with the first dose of Pfizer yesterday. A further 13,465 people were given their first dose of the Moderna vaccine as well. With that, a total of 8,232,194 people have received at least one dose of a Covid-19 vaccine so far, while 1,886,930 people have been given 2 vaccine shots as of last evening. In the meantime, health experts have once again urged seniors above the age of 60 to get vaccinated and help reduce the number of Covid-19 mortalities.
Still, nearly 80% of the deaths are occurred above 60 years of age. Other than that, 80% of the deaths reported among people with other comorbidities. These are the people need to get vaccination. Please promote them to get their vaccination, because we are having vaccine. Now currently there is no much rush even in the vaccination centers. Take this opportunity.
Further, Dr. Ginige also addressed public concerns of current vaccines being ineffective in preventing infection and hospitalization.
Whatever the available evidence, but all the vaccines currently which we are using are effective against Delta variant. Because of that, I think that's some consolation. But still, main issue is that today's in the globalization concept, one country can't protect that particular territory with particular brand. Because even a strong mutated viral strain started, it will spread rapidly to all over the country. Because even that Delta is not in India, but even in the US, nearly 20% of the caseload is due to Delta. Because of that, globally, cases will come. We have to take maximum measures we have already taken to protect importation of the thing. Because of the random sampling technique which we use, we have found Delta viruses in certain clusters. But main key message is whether it's a Delta or Alpha, preventive measures are same. Because sometimes I think our people also now getting Delta strain as some excuse. But it's not an excuse. We have to practice our day-to-day protective measures. Because luckily, vaccination program is rolled out. That's going to be additional support for us. But that's alone not enough. We have to further strengthen our basic preventive measures.
පොකට් එකට ෆිට් වෙන new Axe ටිකට් perfume.